Well, I came to do my training in Basildon. That was where I was offered a VTS training scheme. I used to still commute from Cambridge during the training, and I felt I'm not going to continue that my whole life. If I find a good job in Essex, where I wanted, and fortunate for me, I found the exact place which I liked, and from day one I'm in the same place, and I hope to retire at the same place.
A lot of the London hospitals are very busy and they have a lot of people in training, and you are fighting to see the one exciting thing with 10 other people. If you come out to the peripheries, people are very keen to teach you, but you have more opportunities that you can choose from.
Also, I noticed in Essex that there's a lot more opportunity to meet nurses that work in different surgeries. It's really encouraged, and we have a lot of meetings where we get together and we can sort of share ideas and support each other. I think that's something particular to Essex.
The NHS is changing month in, month out, so you have to adapt them changes, and that's more experience that you're gaining and putting towards what you want to do in the future. But I mean, the more experience I gain, the more courses I take, that will give me that step up the ladder to maybe go into a manager's role.
In the past, GPs have employed pharmacists for specific reasons, perhaps to run a hypertension clinic. But to actually be able to go into several practices within a locality presents really good opportunity, because it means that not only can we influence the healthcare of perhaps a larger number of people, it does give me the opportunity to become the interface between both the pharmacies and the GPs.
My role is a supportive role to the GPs at the surgery. I do a mixture of chronic and acute medicine each day. I see whatever walks through the door, the same as the GPs do. I do a bit of everything really, but I have a specialist role in terms of diabetes. I see all patients with type 2 diabetes and type 1 diabetes, including children, and my role is that I take care of the 20% most complex diabetics in the surgery.
So I started off doing just phlebotomy, and done my training for that, then took on the phlebotomy clinics, and then gradually they wanted me to do more and more, so sent me off on the courses to do ear irrigation, dressings, etc., and doing all of those now as well.
I was very upset to hear that patients would come in and say, if only I'd stopped smoking, if only I'd done this, how am I going to pay my mortgage? And I decided that perhaps if I came into primary care, then through education, support, we could perhaps stop people smoking, look at their lifestyles and make them aware of what risks they were taking.
We have such an excellent network of practice managers. We've all known each other for a long while, we get together once a month, but at the same time, you have that ability to email one another. If you've got a problem, there's always somebody there who can talk it through with you, and you can work with one another to come up with a solution. Very well helped by the CCG. We've got a great team at the CCG.
The continuity of care that general practice gives you is unlike any other area of medicine. You get to support these families through difficult times, through happier times. You get to see such a breadth of different areas of medicine in one day, and for me, no other area of medicine offers that opportunity.
To raise a young family, Essex is great. You've got good social life in Essex, you've got fantastic coastal towns, you've got the quaint little villages in between, and you're also well connected by road and also by train into London.
It's a great county to work in. You've got so much variation really. You've got seaside 40 minutes away from here. I live in a village, so you've got the rural aspects, and then of course you've also got cities and towns. So you've got the best of both worlds, because you've got a bit of everything there.
You can choose a type of general practice that suits you. You can work for a private company, you can be a partner in a business, you can just have a salary, or you can just have little locum jobs that you pop in and out of as you want to.
I think working in the office, you're not always necessarily in the background, but people don't get to see you and people don't realise what you sort of do. Whereas in a reception, you're on the front desk, people greet you, you know, just with that smile, even if they come in unhappy and they come up to you and say thank you so much for getting me that appointment, it can really change someone's day or even life.